The battle over Obamacare begins. Both sides strategizing today on the fight ahead. Republicans finally have the power to repeal President Obama's health care law. Vice President-elect Mike Pence made a trip to the Hill earlier and said it's going to happen.
What's clear here is the American people have spoken. They want to see us repeal and replace Obamacare. And today, my message to members of Congress is that we are going to be in the promise-keeping business. And the first order of business is to keep our promise to repeal Obamacare and replace it with the kind of health care reform that will lower the cost of health insurance without growing the size of government.
On the opposite side of the aisle, President Obama tried to protect his legacy. He went to the Hill. He met with Democrats to plot a strategy to keep his signature law from being dismantled.
The Republicans say repeal and replace. The only thing that has going for it is alliteration. They have no replacement plan. To repeal and then delay is an act of cowardice. We have a values debate on our hands, but it's very personal in the lives of the American people. And so make America sick again? Is that what the Republicans want to do? I certainly hope not.
Well, Greg, she's got her slogan, Make America Sick Again.
Looking at that dress, it's like Pepto-Bismol. You know what? I love the fact that they say, you know, oh, the Republicans, they have no replacement for Obamacare. They have no replacement for Obama. He's like the quarterback that's leaving college, and they have nobody to replace him. They didn't think about it for next season.
Well, thankfully, he's not moving out of town.
That's true. He's going to stick around. He's going to be like Wooderson and Dazed and Confused. He's going to hang out in the parking lot and hit on the younger chicks.
Somehow, look, I doubt it.
Look, I do feel bad for President Obama because, in a way, he is like somebody who's watching his Ferrari being repossessed, and he's looking out the window, and except it's not in a Ferrari, it's a Pinto about to explode because Obamacare is such a mess. But it's even this press conference tells you how bad big government is. If Schumer is saying, like, if you remove one piece of it, it all falls apart. It's like a game of Jenga. And if it's that bad, it tells you how bad big government is. That some kind of centralized monstrosity, once something breaks, it's a calamity. Whereas if in a free market, something else comes along.
Well, that's what they removed. The Democrats removed the one thing that was going to keep premiums down, and was competition. So they took that out, and they said you have to have it, and what the opposite actually happened. So you could keep your doctor. Premiums are going to come down by $2,500 per year per family. The opposite happened. Doctors fled. You lost your doctor. Premiums went up $2,500 per family per year. And so what the Republicans have said, yes, we're going to repeal it first. First you repeal, then to replace it with something that works for both sides. This makes the most sense, and it will include competition across state lines, I'm guessing, allowing more doctors to come in and paying them more. So part of the problem is, like a jacked up Medicare system and Medicaid system, that's what Obamacare is. So doctors are saying, I'm not going to take Obamacare. I'm going to go private practice, not take Obamacare, or I'm leaving completely. So that you bring those people back in, and that will bend the cost curve. That will truly bend the cost curve down.
Well, I just think it's exactly the opposite. In fact, I think competition was certainly at play when we saw premium rates skyrocketing previously without Obamacare, which is why the Democrats acted to bring it into place. And what we've seen subsequently is a tremendous drop in terms of premiums paid by people who get health care from their work, from their employers, from their workplace. So, I mean, I don't think there's any question here. There's benefit to it. There are
premiums have risen by $2,500.
The premiums, what did I say, Eric? I said about people who get their insurance, which is more than 80% of Americans get their insurance from their employers. Those premiums have gone down at a record rate in terms of the rate of increase, so that we can say...
Whoa. There's the trick.
What's the trick?
The premiums haven't gone down. The rate of increase is going down. Premiums are going up, though. You're double talking about it.
That's called a cut.
Of course, right.
The rate of increase was 80-something%. You go down to 30%. You say, oh, there's no. That's a tremendous benefit. In fact, in this morning's Wall Street Journal, there was an op-ed by your friend Ezekiel Emanuel pointing out how because I know you just despise him. But I'm just saying, pointing out that big companies and people who benefit from those lower rates of increase are numerous.
I found that Ezekiel's op-ed a little hard to swallow.
Well, I
this morning.
can
Let me
imagine.
get Kimberly in here.
I didn't even read it.
Yeah,
like most of America.
That's true. That's true.
You can tell.
One thing I noticed is that the Republicans, they sort of have a tiger by its tail, right? So they're going to have to figure out a way to deal with this in a way that is keeping people calm and reassured, but delivering the change that they voted for. And you saw that Mike Pence, Paul Ryan, even Kellyanne Conway, all being very careful to say, we are going to do this responsibly. We don't want anyone who has insurance now to not have insurance. We're going to be careful. And I think that they're trying to just reassure people that they're not going to be without insurance. That's not the goal of this. It's to figure out a way to bring in more competition and bend the cost.
And I think they're being honest. I don't think they want people to be without quality health and medical care. I don't think they want people to be struggling and have this whole abyss where they fall into because there's a gap in between. I think they're being sincere when they say want to do this in a responsible, respectful way, which is what is required. So there's something here that really needs fixing. They've made a promise to the American people. They have to see it through. Now, in terms of the tiger by the tail, it's more like if they got a kitten or something by the tail, because Schumer's just not that scary. And he was on another network last night making a promise I think that he cannot keep, that he was going to do also his best to delay Supreme Court picks. He's making a lot of promises.
We play that sound?
Yeah, we'll play it now.
Okay, this is Chuck Schumer last night talking about all the opposition to come against Donald Trump.
Mr. President-elect, you went after both the Democratic and Republican establishments when you ran, but by your cabinet picks and your early pronouncements, you seem to be embracing the time-worn, shop-worn, hard right. The only way we're going to work with him is if he moves completely in our direction and abandons his Republican colleagues. 95% of the time we'll be holding his feet to the fire and holding him accountable. But we're Democrats. We're not going to just oppose things to oppose them.
And yet you had Senator Manchin today, Democratic senator from West Virginia, who was up for re-election, decide not to go to the meeting with President Obama because he thought it was too partisan. Listen to this.
We had the existing outgoing president coming up speaking only to Democrats today, and we have the newly elected vice president coming in speaking only to Republicans. And I said, you know, we've got to start this dialogue and start building some type of relationships. So I said, I'm not going to go. It would be counterproductive. I'm just not going to do it. I just did what I thought I was supposed to do, and that's basically start building relationships and bringing America together, not letting Democrats and Republicans stay apart.
So, Greg, there's a senator trying to resist the team sport politics of health care.
I wasn't listening. But anyway, I got to be honest. No, I was listening.
He's a mature adult in the room that you said looks like Joe Theismann.
I don't care anymore about Obamacare. It's really hard to talk about it because we all know it's a bad thing. It's a corpse in the room, and it's hard for conservatives because as a conservative, you should be against pre-existing coverage because, you know, you don't buy car insurance after you get the accident to pay for the accident. The point of insurance is you get it before you're sick, but you can't win on that argument anymore.
But that's why we are talking about it. You're 100% right, because the left is painting it like, hey, the GOP is trying to take the 20 million people who are now insured, try and take their coverage away, and I think that's what this whole meeting was today. Relax. We're not pulling the rug out from underneath your feet, but we are going to revamp and bring competition in. May I throw one more number in?
We are going to pull the bandage off.
Pull the bandage off, right, but here's the other number. So these insurance companies, because they have now gone down in some places where there's one option for an insurer, one, no competition. Some there are none, but where there is one, they say, look, we'll keep these premiums rising but at a slower rate, but we're going to stick it to you on deductibles. And that's exactly what they've done. So total outlays for health care over the year and in annual outlays are still skyrocketing. You're not paying it in the premium. You're paying it when you use health care in the first, I don't know, $5,000, $6,000, $7,000.
Keeping people from using it.
Which is
okay, right? If people have skin in the game and they know how much it costs and they make that decision.
That's why you want that. So you talk about competition. Let's talk about the fact that more and more Americans, they're setting records for the number of Americans who are signing up for Obamacare, the Affordable Care Act, right now.
Are they paying, though? Are they the paying customers?
Well, yeah, there are people signing up.
They're the people who are signing up and getting it for free or highly subsidized.
Oh, that's right. They're highly subsidized. Most of Americans are highly subsidized who get Obamacare, but that's not the point. The point is people want this. 20 million
It kind of is the point.
So you have
somebody has to pay for it.
Let me finish for once. So you have who subsidizes when you have unpaid care, when people go to the hospital, they have no insurance? You and me, Eric. So let's talk about something very real. The American Medical Association says, hey, Republicans like Greg Gutfeld, you're so hateful of Obamacare.
How do you know I'm a Republican?
You said you were a big conservative here.
I'm not a Republican.
All right, I'll say big conservatives like Greg Gutfeld say, hate Obamacare. Oh, yes, the AMA says, well, can you do something responsible, like tell us what you want to replace it with, the tiger by the tail, as Dana calls it? And guess what? Republicans, and this is not like, oh, this is a new subject, we just brought this up. Republicans have no idea about how to replace it. Instead, they say, well, what we may do is wait, 2 years, 3 years?
No, I don't think that's what they're
Oh,
going to do.
that's what they're saying, Dana. 18 months to 3 years at a minimum.
I've heard about choice.
Even Rand Paul, Senator Paul, Republican, says it's irresponsible to repeal without replace.
Well, the fact that, okay, number one, Republicans have talked about choice, have talked about competition, private savings and counsel. The idea that they haven't said anything, you're being a bit dishonest, Ron, and I deserve an apology.
Oh, yeah. What competition? No competition.
Competition between state lines?
Before Obama, there was no competition. No competition. Oh, blame Obama. Thanks, Obama.
When government gets, this is what happens, and Obama knew it. As soon as the government gets a little bit bigger, it's hard to make it smaller
You're
again.
forgetting one key aspect of this whole thing. It's going to cost $1 trillion. It's going to cost the taxpayer $1 trillion. That's a new cost to taxpayers.
What is going to cost them?
Obamacare.
Okay, if Obamacare
what you were just giving a speech about.
What you're talking about, you don't even have a price tag because you don't have it. No, here's what you're going to have. Trump care. That's what Obama said today when he was meeting with the Democrats.
You didn't have a free market for health insurance prior to Obamacare.
Of course you did.
No, you didn't. No, you can't sell insurance across state lines.
Oh, and that was Obama?
Can't compete
no,
with
that was a
New York.
pre-existing rule put in by other people.
Trump care, you should buy the gold package. That's my recommendation.
Go,
well, the good news is we'll be able to talk about this a lot more in